Hi, welcome to my week 7 discussion. My name is Brian, and this is in regards to substance-related disorders. Substance-related disorders refer to a group of mental health conditions that are caused by the use of psychoactive substances, including alcohol, prescription medication, and illegal drugs. These disorders can be distinguished from other types of mental health disorders by the specific symptoms they present and the presence of substance abuse. At this moment, I want to address one of the differences I noticed regarding the diagnosis of SUD from other ones. Unlike other diagnoses we've discussed, where it's very logical questions of do they meet these requirements? If yes, then we flip a switch and we have a diagnosis. With SUD, it's more of a spectrum, or like a dimmer switch that has various levels of severity on the spectrum. So what I mean by spectrum is a mild if they have 2 or 3 symptoms, moderate for 4 or 5 symptoms, or severe if there's 6 or more symptoms, which would indicate severe substance use disorder. So what are some of these symptoms? So some of the symptoms might be using substance in larger amounts and for longer periods of time, a persistent desire to use the substance, unsuccessful efforts to cut down, a great deal of time spent obtaining, using, or recovering from the effects, craving the substance, continuing to use the substance despite negative consequences like relationship or work, decreased participation in social, occupational, and recreational activities, right? Tolerance or the need for more of them to have the same or effect. Withdrawal, so experiencing the physical or psychological symptoms. So I wanted to make mention that with the ER, there's a single question that's used. It's an NIDA quick screen single question. It says, how many times in the past year have you used an illegal drug or used a prescription medication for non-medical reasons? And according to Hawk in his 2018 article with Emergency Department Screening Interventions, he said that that single question may be more appropriate in the emergency department setting. In other words, that single question is appropriate in a counseling scenario like what we might be faced with. Additional questions are preferred. So it's important to note that substance-related disorders can often co-occur with other mental health conditions, such as depression, anxiety, and schizophrenia. Therefore, it's important for a mental health professional to assess an individual's overall mental health and substance use in order to make an accurate diagnosis. So, how do we as counselors differentiate SUD from other types of mental disorders, such as what was mentioned? I think it's important to note that many of the diagnoses we've examined to date have one specific criteria, that there be no substance that could attribute the symptoms of the diagnosis being given. Therefore, the presence of the substance would automatically rule out those diagnoses. When a client is still obviously experiencing depression but using substances, what should the diagnosis be then? If substances are present along with symptoms of other mental issues, then we happen to have a co-occurring disorder under a different name. These diagnoses have the prefix of substance-induced, such as substance-induced psychotic disorder or substance-induced anxiety. It is important to note while many of the criterion are similar with substance-induced and other mental health issues, they are not often the same. Additionally, in order for those diagnoses to be present, the substance being abused must align with the diagnosis, such as alcohol and depression. I was shared an article titled Borderline Personality Disorders and Substance Use Disorder, an updated review by Troll in 2018. He said, for specific SUD diagnosis, those with current opioid, cocaine, and alcohol use disorders most frequently received a borderline personality disorder diagnosis. One final note that I just want to touch on is a policy referred to as No Wrong Door. Ted Baker, the Care Quality Commission's chief inspector in 2020, wrote that physical and mental health care have traditionally been delivered separately. While investment and improvement in mental health services are welcome, physical and mental health services will only truly be equal when we stop viewing physical and mental health as distinct. So the goal of No Wrong Door is to ensure beneficiaries receive timely mental health services without delay, regardless of where they initially seek care. So one of the reasons I brought this up is because a personal thought of mine that I want to pass on is that when we go into the world as therapists, let's not have a specific population that we only work with. Just understand that there's many people that are going to come through your door. So be prepared as mental health clinicians to understand that some of these people need help with their substance abuse. Substance abuse touches every population and every culture. Thank you. My name is Brian, and I appreciate you taking time to watch my video.